Mrs. Brown.
Hello.
It's so nice to see you.
Oh,
My name's
thank you.
Megan. I'm going to be your nurse today.
Thank you, Gary.
You're welcome.
Hi.
Do you need me to push your chair in at all?
No, I'm comfortable like
All right,
this.
fantastic.
Thank you.
So what brings you in today?
So I've been having this bubbly feeling like all around here,
Okay.
and I get really bad muscle cramps lately. I don't know why. So.
Okay. Can I ask you a quick question?
Oh yeah.
What's this?
Oh, dear, it's a funny story. So I have 12 sweet cats. And one of them just got really upset at me the other day
Okay.
and bit me.
Oh.
But it's okay. I've been taking medicine for it. It's covered.
Okay.
It's fine.
Okay, do you mind if I take a look at it really
Sure,
quick?
go ahead.
All right. Okay, so it does appear to be a little bit red, and it's a little bit warm, and it looks like there's a little bit of some pus coming out of
Oh,
that.
but that's normal. That's part of healing, isn't it, sweetie?
So a little bit of redness, a little bit of swelling is okay during the first stages of your healing. When did this happen?
Maybe like a couple days ago, 3-4 days ago.
Okay, so at this point I wouldn't expect that much redness or swelling. And then also the drainage, normally very clear, a little bit of clear drainage is normal. But that color isn't necessarily normal. It might be a sign of an infection.
Oh dear, no.
Yes. So what have you been doing to take care of it?
So I've been taking this medicine, Bactrim.
Bactrim?
That,
Okay.
yes. I found it in my medicine cabinet. It's great. So I've been taking that, and I think, it's working.
Okay, so you found it in your
Yeah.
cabinet.
Yes.
So why did you have it?
Oh dear, it was in there for so long. I think I used it a couple of years ago, maybe
Okay.
2 years ago. Kind of embarrassing for UTI.
Oh, not embarrassing at all. Happens to the
Yeah.
best of us.
But those things don't expire, so I just kept it in there, and then I started feeling better
Okay.
when I had it, so I just stopped using it. So that's why I saved it, and I was like, oh, I'm gonna use it later in time for something, and this is what it's for.
So that's not uncommon. A lot of patients do that. Normally, though, when we're prescribed an antibiotic, it's very important that you take all of the dosage, even when you start to feel a little bit better, because not all of the virus is completely killed off, even if you're not experiencing any symptoms.
Oh dear.
So it might make it harder to treat other infections later on. So as I said, it's just very important to take all of your dose, even when you start to feel better.
Even when I start feeling
yes,
better, everything.
Exactly,
Okay.
yes. And then also, you mentioned that it didn't expire, but medications do often expire. So it's very important that we're checking the expiration date before we take medication.
Okay.
Yep. Normally we don't see any severe side effects if you take them when they're expired, but most of the time they don't work as well as when they are initially prescribed. And it's also very important not to take any medications that aren't prescribed for that certain thing.
So I would have to get like a medicine for my cat.
Yes, exactly.
Oh, I didn't know that.
Okay.
I thought just medicine was medicine, and it would treat,
No, unfortunately, I wish there was a magic pill that treated everything, but so far we don't have that. But I want to ask quickly, do you have any other medications that you're taking currently?
Yes, I take 2. I'm not going to pronounce these right,
That's
so
totally
confusing.
fine. Okay.
Something with a statin or a statin at the end of it.
Okay, it looks like in your chart you have simvastatin.
That, and I
Perfect.
take that for my high cholesterol.
Yeah, okay.
And then I take lisinopril.
Lisinopril,
That one.
Yeah,
I think
that's
I have
okay.
high blood pressure, so I take that one.
Okay, perfect. So you also mentioned that you had bubbles in your chest.
Yep.
It sounds like you were saying, and you have the muscle cramps.
Yes.
Okay. So one of the common side effects of Bactrim is actually fluid filling within your lungs. So that could actually be causing the popping bubbles that you're experiencing. Yep. But as soon as we discontinue the Bactrim, you should start to feel much better in a couple
Cool.
days.
I was getting so worried.
Yes. Oh, I believe it. That must have been such a weird feeling.
So weird.
And then Bactrim actually does have a couple side effects when it's mixed with lisinopril and simvastatin. So with lisinopril, that causes an increase in your potassium, which can cause the muscle cramps. So once again, as soon as you stop taking the Bactrim.
So this is all because of my medicine.
Yes.
Oh dear.
Yes,
Okay.
exactly.
So now I know never to do that again.
Right, exactly. Because the thing is, medications do often interact with other medications to cause side effects that we don't want to happen, as in the bubbles popping and the muscle cramps.
Okay.
So consulting with your doctor first is very important because they can pick out the perfect medication that won't cause any of those side effects, or will at least cause very, very fewer side effects. And then with Bactrim and simvastatin, that one can actually cause a little bit of kidney damage. if you've only been taking the medication for a few days, I don't think you're at any risk. But I am going to call your physician. We will set up an appointment so he can check out your wound there, and then we'll also figure out the correct medication for you to take, and he might have some labs for you to complete as well. Okay? Alright, do you have any questions for me?
No, dearie, thank you so much. You've been so helpful. I was so worried.
Of course.
Thank you.
You're so welcome. Have a great day.
Thank you. You too.